Are we worried about somebody being an alcoholic or a drug addict? Because this does happen more than we like to say in our profession. But there are also pieces where there's financial difficulties and the dentist is overwhelmed, or they're having a personal problem, or they're very, very depressed. And we need to acknowledge that dentists and doctors are human, and sometimes we need to go in and check on them. That doesn't mean we're going to allow them to do bad work, but we are going to go and try and help them.
Welcome to the Authentic Dentist Podcast. Join Dr. Allison House of House Dental in Scottsdale and Shawn Zajas, founder of Zana, as they lead dentists deeper along the journey of authenticity to reach greater fulfillment in their professional lives and to deliver remarkable patient experiences.
Well, Allison, happy Friday. The interesting thing right now is just the idea that things aren't always as they seem. And I think that kind of rings true for you based off of something that you experienced earlier this week.
So we were talking about a Facebook post that I read, and it was about a dentist who saw some very poor work over and over and over again from a colleague. And he was not being very kind about it. And I understand we've all been there where we're upset on, you're not doing good work, you're embarrassing us, because this is not what dentistry is about. We care about patients. And so he was lamenting that, this guy is really doing bad work. And now he has to tell this patient that all of this work that she just had done has to be redone. And I get it. We've all seen this happen before. But I can't help but think about that other dentist. We went to dental school at a time always where perfection was the standard. I mean, we've all been trained that way, that we are expected to be perfect all the time. And when you see a dentist that is not doing a good job, it's not like they don't care. I find it really hard to believe they don't care. I feel like there's something more going on. There's some story there that I'm not privy to, and I just don't want to throw that dentist under the bus. So I wrote back on Facebook about our Arizona Dentist Concern for Dentists. And I love this about Arizona. So we have a committee with our local ADA where there's a group of people that will go out. You can call and say, I'm worried about this dentist. And they have trained dentists that will go out and speak to the dentist you're concerned about. And the whole point was alcohol. Are we worried about somebody being an alcoholic or a drug addict? Because this does happen more than we like to say in our profession. But there are also pieces where there's financial difficulties and the dentist is overwhelmed, or they're having a personal problem, or they're very, very depressed. And we need to acknowledge that dentists and doctors are human, and sometimes we need to go in and check on them. That doesn't mean we're going to allow them to do bad work, but we are going to go and try and help them. And so this Dentist Concern for Dentists will go in and have that conversation. And if they need help with drug treatment or alcohol treatment, they have resources.
Okay. So hold on a second. You're telling me that there's kind of, I don't know, like a baseline skill or taste of like, this isn't just like immature dentistry or dentistry that's, I don't know, a little misguided. Like, it's flat out bad. And if bad dentistry is coming from someone that doesn't lack experience, then maybe there's something else going on that's influencing this kind of impairment. Like whether it's an emotional impairment, whether it's actually someone's under the influence, or there's some other pressure going on because this dentistry shouldn't be consistently this subpar from someone that knows better, kind of.
Yeah. So we all have a bad day. If you're human, you're going to have a bad day. You're going to put a crown on that went on sideways and you have to redo it. This happens to all of us. It's just life. But that's not the same as having 12 crowns that went on incorrectly and you didn't fix them. That's a pattern and that's a problem. And that dentist needs to be helped. I don't think they need to be punished. I think they need to be helped and figure out what's happened. So I think that if you know that 12 crowns went on wrong, you're going to fix them. That's just the way we were raised in dental school. That's who we are. So if you're seeing a pattern from another dentist, that's a problem, and we need to address it. And it doesn't have to be that we call the board and report them.
Okay, so in your 26 years, 26 years, has there been a time where something similar like this happened? Either that you heard someone else talk about, and again, because of someone checking in on them, they realize like, oh, they're just in a really difficult time in their life right now, or something is going on. Like, has this ever been the case? I guess is what I'm trying to get at.
Because I have three separate stories that are all different. So one of them is this patient came in and I saw some bad dentistry. And it was from a very famous dentist that was down the street from me. Just not a pattern, just one. And I arrogantly told this person, oh, this is terrible work and I'm going to fix it. And I fixed it. And then I fixed it again. And it looked the same because this patient was very, very difficult to work on. So it wasn't a matter of this other dentist did a bad job. She was a great dentist. And it wasn't that I was a bad dentist. It was that this patient was unbelievably difficult to work on. And so that is always a possibility. There have also been times where I had a patient who had Parkinson's, and that was a nightmare to try and do work on them. It was probably the most difficult crown prep I've ever done in my life because the patient kept moving. And I do worry that someday somebody's going to look at that and go, that's not a great prep. It wasn't. Let me tell you, it was not. And there's nothing that could be done better unless we sedated the patient and he was 90, and that was not going to happen. And then there's the situation where I consistently saw a lot of bad work that came from somebody. And the last patient that came in told me that she smelled alcohol in his breath. And that's a huge problem. And I had an ethical obligation to do something at that point. And so I called Dentist Concern for Dentists, and they went over, and indeed, the young man did have a serious alcohol issue, and he was put in rehab. And he doesn't know it was me, and I never followed up. I don't know anything else. But I'm pretty sure that had he continued down that road, he would have died. So, yeah, I think sometimes when we're looking at what's going on, it's a reflection of what's happening with the person.
Okay, so I'm familiar with the terrible stories that come out over time in dentistry where everyone knows someone that was a dentist committed suicide because of the profession. On the back end of those cases, do they ever find out that there was some sort of tell where all of a sudden the patient base or the team or someone close to them realized like, oh, maybe that makes sense now because we noticed that their dentistry was slipping or there was some lapses? Like, does it prove when people investigate that there are some tells?
So I know this anecdotally. Yes, there are tells. And you cannot practice good dentistry if you are high on cocaine all the time. You just can't. And so you are going to see that. You're also going to see people taking bigger risks that maybe
to our recent graduates. That's some wisdom right there. You cannot practice good dentistry while on cocaine.
You cannot. And so if we can tell that, we could intervene and maybe save somebody's life. So yeah, I think if you're seeing bad work, and again, not just one, but a lot of bad work, then I think we care about people and we find out what's going on.
Well, so what's fascinating about this story is that you were saying this individual that posted about the bad work received a lot of feedback and lots of comments, but yours was the only one that was like, hey, maybe there's something going on with that dentist that you just need to reach out and help them. No one else kind of brought that up, huh?
No one else brought that up. And it's because it's a harsh profession. We are really critical of each other and we never give each other any space to be human. So, I mean, it was very nice. So they took my constructive thoughts and posted about it. And that was very kind. And I appreciate that. And I'm glad that they reached out. But it's bigger than that. It's about patience too. You know, you have that patient that's always been so sweet. And then she comes in and she yells at your staff and she's rude. If this is not typical for her, what's going on? You know, sometimes things happen to people and you don't know why. And we don't just dismiss people because one time they acted terrible. You got to find out, like, what's going on? Why are you so upset today? And it could be that, you know, their mother just died. I've had that happen where somebody just went ballistic in my chair. And I was like, this is not like you. What's going on? And it was her mother died the day before. And I was like, why are you here? Why do you want to miss my appointment? Oh my goodness. Go home. This is going to be fine. We will get this done later. But that was she just didn't know how to deal with that level of emotion.
Okay, so inconsistency with the dentist, possibly patience. What about team members? Like, just hypothetically, like if all of a sudden a team member that you've trusted, it starts acting differently. Have you ever encountered anything like that?
Absolutely. I mean, it's been 26 years, Shawn. It's a lot of years. Yes. Usually you can ask. And if you have a small team like I do, you can say, hey, what's going on? Why are you Why are you so upset about everything?
So anyone watching is going to understand that I was lacing that with sarcasm, just because of the situation with one of your team members, where they had been a stalwart, but they've been consistent for so long, and then all of a sudden there were some inconsistencies. But I don't know, maybe they just deserve the benefit of the doubt until all of a sudden they started adding into a pattern, and that pattern actually indicated that there was something else going on there. So it's like, yeah, I would say this is kind of like a tell for whether it's the patient, whether it's your team members, whether it's another dentist. These are just patterns of behavior when someone's struggling or into some sort of, having a difficult time in their life. There's little things that come out.
Absolutely. And there are times when you're going to give somebody some grace, when you're going to help them. And there are times when the situation is such that you can't keep that team member because they're a safety hazard for your office. I did have a team member that had a drug issue. I couldn't keep her. That was too dangerous for my practice. And she didn't want to get help. That's the other piece. If you have somebody who wants to get help, that's a different story than somebody who doesn't. But I have also had patients that are team members. I had a team member whose daughter was having a difficult time and she had to keep her granddaughter. And her personality changed for a little while because she was so overwhelmed with the new responsibility and her daughter being in a facility, and it was a lot. And that was one of those moments when I didn't want to fire her. And so actually, I wanted to encourage her because part of it was insecurity. And she loved Friends. So I made her a box that said her name and her granddaughter's name, Box of Fun. And I put together a lot of like movies and Starbucks treats. And I gave it to her. And that sort of shifted, that she knew I cared about her. And yeah, so we care about people. We don't always keep people. Sometimes I care about people and I can't keep them in the office because their behavior is so bad. But I do think it's worth having those conversations, checking on people and offering resources.
And I think it's difficult to know the balance of like, when do you give mercy? When do you intervene? When do you make a course correction? And I think that's kind of like on a case-by-case basis. Right now I've been talking with lots of different comfort dental doctors because of one of the projects I'm involved in. And one of the things that they're known for is pretty much accepting anyone that needs care, lots of Medicare patients. And yet I'll ask them, is there a patient that's not a fit for you? And they'll be like, just if they're disrespectful and they're really, really unkind to my team, I won't see them. Sure, if they're in pain, that's like one thing, but still, there's a line of disrespect where we won't tolerate that. We don't need to see people that are going to be mean to other people. So even that, just to see like where someone draws the line.
And there's a line in every practice, and everyone has to make that call for themselves. I can tell you that I have a gentleman in my practice that's been with me maybe 15 years. And all of a sudden, he's making a lot of inappropriate jokes to my team, like really inappropriate. And this is not him. And I just thought this was odd. So I spoke to him and he got really defensive. His wife came in not too long after that. And I happened to mention, hey, is your husband doing okay? And she said, no, he's starting to suffer from dementia.
Mm.
Oh, okay. Well, then that's a different story than just a dirty old man. This is somebody who's losing his filter because of dementia. So I'm willing to make some accommodations for that. Whereas I'm not if you come in and that's the way you started to act from the beginning. So again, it's all individual. I'm trying to pay attention to my team's needs and patients' needs, but I'm also trying to care about other doctors because I'm not perfect. I've made mistakes, and I hope that people give me some grace when I make mistakes.
Yeah, I think the most difficult part of dentistry across the board, whether it's a scientist dentist or the artist dentist, is just the fact that we're still dealing with people, right? Your frontline care, you're dealing with the team members all the time, and then you're dealing with patients. And it's the humanity aspect where there's not always a blueprint, there's not always a script, it's not always predictable. And yet this kind of leads straight into one of the things that you absolutely love, which is the whole do the work exercise that you walk through. You've walked me through so many times when I'm almost positive that my perspective on this situation is correct and I am justified in being, I don't know, butthurt, resentful, bitter, offended, whatever it is. And you're like, okay, Shawn, let's do it. Why don't you just tell our audience a little bit about what this is?
So my cousin, Trisha, taught me about the work, and it's the work of Byron Katie. And it's just a little form that you get off online. And it's called Judge Your Neighbor. And you have to say whatever it is that you're upset in a certain way. I'm angry with George because he was disrespectful. And once you do that, then you sort of analyze all the pieces to it. And once you get through the entirety of that worksheet, the Judge Your Neighbor worksheet, a lot of times you recognize that George is being disrespectful to you because you were disrespectful to him. And you were disrespectful to him because you found that there was a fence that wasn't really there. So as you go through, a lot of times you can start to see someone else's perspective, and you can see yourself through their eyes. And that's just really helpful. That, sometimes it's really hard to see yourself and how people are perceiving you without really looking around, and doing the work is a great way to do it.
Yeah. So the only way that is clear for me, like, because you asked me earlier, like, hey, where does this connect in your life? And I'm like, well, the most obvious place is just when I'm driving, because every now and then there's that jerk driver. And I'm like, it could just be that they're being a jerk. That's possible. Or it could be that there's some crazy circumstance going on and they need to be somewhere because someone's life depends on it, or they just got terrible news and they're rushing off the hospital. I don't know. And it's probably not common that that's the situation, but I'd rather err on the side of, I don't know, it almost like gives me an out from just getting upset about someone being a bad driver. So it's like, I'd rather err on the side of giving grace and understanding, because you don't know. It's like, you don't know what someone's going through. You don't know what's happening with their child. You don't know what's happening with someone that they love, their health. And I think that's kind of the perspective that I really appreciate about you, Dr. House, is that you always consider the human and the individual and the person. And you're not quick to assume that we know exactly what's going on. And, like with this dentist, I love that you were just like, hey, there's a chance that consistent bad outcomes means that something's going on. And maybe we need to reach out and help this dentist, because this is a tell that something else is going on, something deeper.
Absolutely. I highly recommend the work by Byron Katie. There's lots of videos online, and there's a book that'll help.
Thank you for listening to the Authentic Dentist Podcast. To join Allison and Shawn on this journey, hit the subscribe button to never miss an episode. Here's to your success. Express yourself fully. Live authentic.